Hey everyone, I'm Sherry from Structural Health and Wellness, and I wanted to come on here and do this video. I've had some people reach out to me about some self-care techniques, especially people in the front lines that are healthcare workers who are wearing masks and are noticing that they're getting a lot of strain and tension in their neck. They're getting headaches and I think some jaw pain. So I decided to put together this self-care video to help with that. But first, let me just say thank you for all the work that you and everyone on the front lines are doing. Is appreciated so greatly. So I'm very happy to put this video together for you. So one of the things I would like to just point out too is that when we're feeling a lot of pain in the back of our neck, it's usually because it's coming from the front. So our heads are being pulled forward, and a lot of these people, these EMTs and paramedics and anyone who's working with their bodies forward, whether it has to do with the masks, the doctors, the nurses, they're putting a lot of strain on the back of their neck, and these front muscles are getting really tight and they're kind of holding in that position. So the specifically the sternocleidomastoid, the SCM, or the scalenes as well. So today we're going to look at mostly the SCM, but this will also help clear out some of the adhesions in the scalenes as well. So first we're just going to do a nice soft release here. So you're going to find that, and if you pull your head forward, you can kind of feel that SCM right there. Using one or two fingers, I'm going to say keeping your head upright. And you could do this laying down is probably better, but if you're standing up, that's okay too. I sometimes do this in the car, shh, don't tell anybody. And just gently rotate your head to the opposite side while you just put a little bit of pressure and you clear it out. I like to go all the way to the back as far as I can. Then come back up, maybe up another two fingers, and rotate the head slowly, keeping it in more of a neutral spine position. So you don't really want to be forward or your head down, keeping it as neutral as you can, and rotate. And then you're going to come right back up underneath that mandible and rotate slowly. And you'll find some congestion here as you get closer out to the mastoid process where that inserts. Okay, then you're going to come over to the other side. You do the same thing, find that same spot, and just slowly rotate the head while you clean that out. Feels really good. I noticed for myself, this right side is pretty tight. I haven't had body work in a while either because of COVID-19. Gonna rotate. And again, this feels really good. You'll notice areas where you have a little bit more tension, but this is a little bit more of a warm-up. Then you're going to go back and you're going to hit those same kind of fibers, muscles. My necklace is a little bit in the way here, but you find that same SCM. Take your thumb and just apply gentle pressure. This is gentle. Okay? This is not, you're not killing yourself. You're not choking yourself. This time with your head in the rotated position, you're going to slide that thumb up on that big muscle. You're going to feel it. And you walk your fingers. I like to just say walk the fingers up the back. And you'll feel this releasing as you go along. This feels wonderful. Walk it right up from underneath that jawline, close to the mastoid process. And then you can kind of really find another fiber. Just go a little bit more lateral there. You'll find another tight spot. And just do the same thing. You know, again, this feels really good. And go right up to that mastoid process, and then come to the other side, grab that tissue, kind of pull it away a little bit. Mine's really tight on this side, so kind of kicking myself out here. And just a gentle pressure. Oh, there's that necklace in the way. You're gonna walk it up. And then maybe go out one more. And walk it up. And you could do this a little bit slower. I'm walking through a little faster because I don't want to take up all my time with this. I want to show you a few different things. So that is something that you can do. That right there is going to alleviate a lot of pain and pressure that you're feeling in the back of the neck. Also, if you're feeling any nerve pain referral, this may help with that. I'm not saying that it will. It depends on what you have going on, but this is something that could help with that. Also, if you've got ringing in the ears, ear pain, dizziness, tinnitus, ocean sounds, things that are going on in the ear. Just clearing that up alone could make a huge difference for you, okay? So that's number one. Number two, I'm gonna grab a little prop here. Prop is my towel. Now, I don't recommend a fat towel. You don't want anything that's too thick. And please, if you have any neck problems, anything that's significant, bulging disc, herniated disc that you know of, skip this altogether. Use your judgment. Please consult the doctor. I'm not saying do this if you have neck issues. This is simply to relieve some neck tension. My towel here, you can see, is not real long. My arms aren't here. So just shorten it up. You don't want it too thick because you need to be able to extend the neck. So the amount of pressure is very light here. I'm just going to the end range of the towel with just a little bit of forward pressure. You can see I'm using my fingers like this, so I'm not even pulling a lot of pressure here. The head is in neutral spine, which means I'm just keeping it upright and looking forward. And then I'm going to gently extend up and look at the ceiling. Hold it for a second. Bring it back to the center position, not down, just to the center position. And look up. And back to the center. And look up. And back to the center. And you could do this, 5 times, 10 times, 15, 20, 30, whatever you have time for. I find that this alone, if you've just got a quick minute, is really good in relieving some pressure and tension. But again, please don't do this if you know that you have neck issues, okay? Stick with doing the soft tissue release, which is very beneficial, and it's going to relieve a lot of that pressure anyway, all right? Another thing that you can do is right along the back of the neck, the splenius capitis, that goes right up to the occiput, and this is a pretty big muscle right alongside the spine there. And you can just, I like to think of this as like kind of what the mom would do to her kitty, the cat. We don't have a scruff like that, and you're not going to be directly on the spine. You're going to be just lateral to that, okay? So you're just going to grab it as I'm grabbing this tissue here to show you, and you're just kind of moving it. You're just shaking it. So I got a nice grab on my neck, and all I'm doing is gently rotating my neck. And you'll feel that. This feels really good. Now, there's not a lot of tissue here, and it's feeling pretty tight, but you can walk your hands up to that occiput as well. So it might get a little bit tender where there's less tissue to grab, and that's usually going to be closer to that insertion point. And again, this is common for people with headaches will have a lot of tension in this muscle. So you're just grabbing it and rotating the head gently back and forth, and that's it. So if you just did this, open this up, and that, you're going to feel amazing. Another thing that I'm going to suggest here, and I'm against the door here. There's the doorknob, so I'm going to get away from that. You can do this on the floor, which is what I recommend, but you're just going to lay on a hard surface like a bed or floor, and all you're going to do is gently push your head into the hard surface for about 3 seconds, and then relax it, and that's it. Just do that once, and that, after loosening up this soft tissue, is just gonna kind of re-educate the muscle. We'll say reset it, re-educate it. Kind of allows the body to say, hey, okay, this is where we want to be. We got it. That's a very, very simple one. You don't even really have to do that one, but I like that one. I think that one feels good for me, and sometimes when I do that, I can kind of feel things just shifting around. It feels really good. And the last thing that I want to show you is, this is all that I grabbed here. It happens to be what I have. It's a kind of like a rubber ball. This one has spikes on it, but you can use any ball. A tennis ball is really good. Lacrosse balls are hard, so I don't generally recommend that. I mean, I like to use it on myself, but for most people, it's going to be very uncomfortable. So usually we feel a lot of tension at that upper trap and levator area, and that comes from the rounded shoulders and the head leaning forward. So if you want to just release some of the tension there, you can grab a ball and go up against a door, a wall. The floor I like to do, but if you have a hard time getting up or down, or it's just not in a place where you want to lay on the floor, maybe you're at a hospital, maybe you don't want to lay on the floor there, just find a spot you know, put it around that scapula. You can't really see where I have it, but just, you can kind of just roll on it. You know, you're going to find where the tension points are. If you're doing this on the floor, it's great. You can go all around the scapula there, and then just move the arm around a little bit. You know, just take it in different ranges of motion. My body likes this one, and then you can move down to a different spot. So this is getting to the top of my shoulder. I don't know if you can see that ball there yet. And you're just pressing. So it's your body weight into the floor or the wall, and you're just moving your arm into a few different positions. And then you can do the other side. And I do recommend doing, by the way, all of these on both sides. Even if you have one side that's bothering you more than the other, it's good to do both sides. Yes, I just smacked my elbow on there, but that's okay. Okay, so there's just a few things that you can do to help alleviate some tension and pain in your neck and shoulders while you are, you know, unable to get body work. Always use caution, and if you have any questions, please feel free to reach out to me. I'm at Structural Health on Facebook. You can message me there, or you can email me at structuralhealthandwellness@gmail.com. Again, thank you, everyone. Please be safe and healthy.